names.
All right, students, you guys know the drill. Jasmine, start us off.
Hi, I'm Jasmine Bojack.
Okay. Who else?
Hi, I'm Amber Sarpal.
Amber, got it.
I'm Justin.
Justin, nice to meet you, sir.
Hi, I'm Carma.
One more time.
Carma.
Carma, got it. Perfect. Who else?
I'm James.
James, nice to meet you, sir.
Nice to meet you.
Is that everybody?
Hello, my name's Ellana.
Ellana, got it.
Yes.
Got it. Okay. Ellana, got it. All right. Anybody else? That's it. All right. Let's get it started. Do you want me to just jump into it, Jim? Good. I am a chiropractor, so my backlight isn't working very well. Probably technical difficulties, probably my operating error. I've been a chiropractor for over 20 years now. And the reason I love what I do is that my wife asked me this a couple weeks ago, is what's your favorite day of the week? I go Monday, because I love seeing patients. I love taking care of people. I love making sure they're doing well. I'm making sure they're doing well from over the weekend. I'm doing their stretches, exercise, everything. I'm their chiropractor. Yes, I deal with bones. Yes, I deal with nerve problems. Yes, but I'm also their coach per se. I want their health to stay well. So my biggest thing as a chiropractor is worrying about someone's overall well-being through their spine. I treat the bones. Yes, I treat this thing over here. Close off the mount right there, where I push this around all day long, this spinal thing. And what it does for me allows me to alleviate back pain, neck pain, nerve pain, headaches, and also improve people's sleep. People that are feeling stressed from sitting so much, watching Zooms like this, their back hurts, their neck hurts. I see some smiles. You guys are paying attention. I got it. Okay. So it allows people to realize my profession is meant to get you healthy. We call it in the big picture quality of life. People probably talked before the quality of life pain scale. I want to make sure people understand is with quality of life improves, you feel less stressed, you feel strong, you feel happy. Happy is, yes, subjective term, but can we make sure when we're feeling happy, that point our perception of life, whatever that perception is, whatever that picture is, whatever the video you're watching is going to be a positive or optimistic point of view. Okay. As a chiropractor, I did my undergraduate school at UC Riverside down the street in Riverside over here. I live in Upland. I work in Upland. And with my schooling, I did a pre-med schooling program. So I took the hardcore science, or not the hardcore sciences, the biology, chemistry, organic chemistry, some physiology also, and then had some other classes to get myself through 4 years with a BS in biology. And then from there I worked for a couple of years. And then from there, I went to chiropractic school. It's a 3.5-year program. Okay, accelerated through. There's one in La Habra area over there. They call it Whittier, but La Habra combination. And the schooling is not easy. Half of my class never graduated. Half my class 5 years later, I'll talk about a little bit why. Half my class 5 years after graduated with a full license, full credential, full board exams, everything certified, done, are doing something else now. And I'll go over why characteristics, why they dropped out per se. If you can learn those, you can use them in any profession. We do. Okay. As a chiropractor in my community, we've done well. We've actually grown through the pandemic. We've been able to get our practice to a higher level of seeing more people, of seeing qualified patients that really want to get in for chiropractic, that have neck pain, neck tightness for one, two, or back pain, especially in this last couple of years of sitting for so much for their work, and especially for their school like yourselves too. All right. So in my work day, what I do, I work in my house 3 days a week. I work 8-hour days, so 24 hours a week on my profession, which doesn't seem a lot. When I'm here, I work. I see patients. We have a high volume practice, meaning we see about 300 patients a week to my partner and I, and we stay busy the whole time. We have a good social media presence. This office has been a chiropractic office since 1980. Who was born before 1980 besides me? Me and Joon. All right, we're the seniors of the group. Okay, and then I am a chiropractor by trade, and I love what I do. I'm the 5th doctor here, so I was mentored. This is the biggest thing what I want people to understand. I was mentored from my previous partner's partner who retired at 35, was done financially at 35, was just, I don't have to work anymore, because he did it. He learned a lot of training programs to understand how to help people. A lot of what we do is, yes, we help people with their spine, their back pain, neck pain, but also we want to communicate well with people. So we do videos on explaining how chiropractic works, why we do what we do, how it can help them for 1, 2. So communication is huge. Not only say through social media or through these workshops or talks, but also through our patient one-on-one communication, what they call it a doctor-patient relationship. We want to make sure that is on point every time. When someone comes to my office as a new patient, what I want to do is help understand them, okay? But I also want to build their trust. What do you think is more important, trust or understanding? Number one is going to be trust. Most people come into a chiropractic office and they have some type of anxiety about getting adjusted or have some type of stereotype of what we do. So I want to make sure they can be honest with me and help me understand what they're doing by making sure I build that trust. Or something in what I've talked to a lot of students about is something called like attracts like, okay? So if someone sits a certain way or talks a certain way, I'm going to try to mimic them to a certain point so they can learn how to, they can feel comfortable with me and trust me over time. So understanding that, then I can build their trust by a tone of voice. If they talk at a high volume, low volume, how fast they talk. Do they cross their legs? Do they do hand gestures? Do they shake their head when they talk too? So I want to make sure I show them that similarity so they understand the importance of being consistent and being with them when I'm with them. I'm not on an iPad. I'm not on my phone the whole time looking at my phone, putting down notes. I'm with them, looking at them straight in the eyes. Maybe like a crazy stare or something like that. Not a crazy stare, but something where it's more of I'm with them the whole time. Okay. Once I see them as a new patient, we may take some x-rays. We go over those x-rays too, so they understand the structure, what we're going to treat them. At that point, we treat them. When I treat somebody with an adjustment, the first time I adjust, especially their neck, you can see my videos on social media today if you wanted to. I expect about 4 different reactions, okay, when their first adjustment. It's going to be either laughing, crying, speaking in tongues, or having Tourette's, okay, any of those 4. So, and we have no idea what can happen. So part of that, when I tell them that this is their first adjustment, they tell me it's the first time seeing a chiropractor, I go, I'm excited for you because we're going to figure out what's going to be. Once you get the adjustment, then I always ask them, how do you feel? Better, worse, or the same? 9.5 out of 10 times, it's going to be better. And when they say better, I want them to understand what better is. I want them to tell me what better feels like. It's going to feel lighter, less pain, more relaxed. Those are more my top 3 that I get from patients. So when you help someone with chiropractic, realize you're helping their life feel better, not just your back pain or neck pain. My profession, you're not going to make $300,000 as a chiropractor. If you do, you're working way too hard and you have too many offices open at the same time. Okay. You're going to make anywhere from $80,000 to $120,000 at the low end. If you work hard, between $120,000 and $150,000. And again, I work 3 days a week. I try to golf at least 1 day a week, and I try to work out every day. Okay. I chose the profession so I can enjoy my personal life and enjoy being a professional chiropractor, clinician, doctor, whatever you want to call it. Okay. Another thing as chiropractors, for one too, a lot of what we do is sometimes, as I do, is we want to communicate with our patients. So we can't just be in the office all the time. We have to do sometimes videos, sometimes talks. We want to make sure we promote ourselves because a lot of people don't know what we do. So with my social media, what we've done in our office since 2012, so about 10 years now, is be on YouTube, be on Instagram, be on Facebook, be on TikTok, be on all the social media, even LinkedIn, things like that too, to help people to see us when they want us to see them. Okay, so in the sense, what I mean by that is when someone has back pain, they're going to know they saw this commercial, they saw this video, they saw this talk, they saw this image over and over again over a period of time. They're going to want to know where to go. It's called branding your office. So I do a lot of videos on how chiropractic works, education videos, even a podcast too, with a lot of healthcare professionals from around the world. As you know, with Zoom, you can connect anyone in the world. So I've done talks to people, yes, in the US, Utah, Colorado, Florida, Michigan, New York. One on Tuesday was Michigan. I've done them in London, done them in Germany. Okay, had one in Taiwan set up, but they lost power. It was a monsoon season. So I'm gonna do as much as I can to promote chiropractic, but also promote other healthcare professionals because it's a wellness clinic. I want people to know that we're gonna help them no matter what, in our office or not. All right, so any questions so far? Any questions?
What kind of, sorry,
Sure.
what kind of patients do you work with? So I have spoken with a chiropractor in the
Yes.
past,
Mhm.
and they have worked with kids with autism,
Mhm.
neural development orders, and such that. So what kind of patients do you mainly work with?
We work good. Thanks for the question. We work with a lot of people that have mechanical issues, say back pain, neck pain, injuries from accidents or trauma or falls for one, too. We work with some people that have other conditions that might be more long-term for one, such as even scoliosis for one also. We work with some people that have some ADHD, ones like that also. But a lot's going to be is can we correct their nervous system, again, like autism for one, too, to help their body function better. If the body's meant to be at a homeostasis where it can function, handle the stress of our environment, we get them there at a certain state, whatever their level can be, and help them maintain that with stretching, with exercising, maybe mental or physical, even brain work to make their overall body get and stay healthy. That's the big picture. Some people we don't, in our own office, we don't deal with infants for one, too. We do not deal with infants, okay? But we do deal with seniors or elderly to help them become more mobile, recover from an injury, and help them feel independent as much as possible. All right. Any other questions yet? One thing is someone asked me, are you happy being a chiropractor? I go, I love what I do, okay? I help people every day. I work 3 days a week. I don't wear a lab coat. I wear Joon shirts all the time. This is what we wear, okay? We wear collared shirts. We look professional. You want to look, if you're going to go into healthcare and especially work with people directly, you want to be able to look professional, but not too casual. I know some people that wear Hawaiian shirts to work or wear a hat. I go, I'm not Dr. Seuss. I don't know if you guys know who Dr. Seuss is, but a lot of it is you want to be at a certain level where they're going to respect you and again, give the same respect to them. Okay. So you want to make sure you've done enough. And again, I was mentored by a doctor, like I said, retired at 35 and even before that too. And back then we did wear lab coats, but as things change, you want to make sure you're at the same page as everybody else. So you overall see that overall benefit of being with other people. So for example, what we do too, let me check some real quick. For Miss Amber then, quick question for Amber. Which one's Amber? Who's Amber?
That's me.
Amber, have you, in looking at healthcare professions, have you done any volunteer work?
Yes, I kind of like volunteered around at a clinic.
Good. Why would you think that's important?
I think it's important to gain experience on interacting with patients and just interacting with people in general. And also it's good to learn from people who are experienced in the healthcare field.
Good. I like that, Amber, because you're shadowing, understanding what they do, and you're gaining information that way too. In my office, Amber, what I have and everyone else too, I have interns come in every semester from the local RP program, from Upland High School, from other schools too. And right now I've went from Citrus for the summer, Citrus College. And a lot of it is they want to come in and shadow to see what I do and may not become a chiropractor, but learn that bedside manner, that doctor-patient relationship, and see that progress over time. So they understand, yes, you can read in the books, you can watch a video. But when you're in an office, you see that direct communication, that direct response, that reaction time, maybe as a chiropractor, yes, but also as a human being, understanding where they're coming in with. When I go to room 2 instead of room 3, what they're coming in with, who they are, what they did last week. So a lot of it's in my head. When I look at a chart, their name, yeah, they know their name, but what do they do in their life? How's their exercise going? Where's their pain level today? So I may spend only 5 minutes with a patient in a room, but I've learned a lot in that 5 minutes, how to help them, how to feel better for their next visit, maybe in a couple of days for one too. So I want to work with them exactly how to improve their life, and being an internship and mentorship, like you had mentioned too, allows you to see that direct contact. And really for you and anyone on here is to see exactly how it's going to help you. One thing too, Mr. Who's Justin? Justin, have you done any
Me.
volunteer work?
Yeah.
So what have you done?
I've done there's like community like cleanups. There's also the volunteer like clinical work.
Good. What have you learned from that, sir?
I think from mainly clinical side, I would say like the bedside or like the people talking skills, just
Mhm.
communicating, and then from the community ones, I think just like the how do I say it, like connectiveness kind of thing.
And it's teamwork, right? You're able to
Yeah,
communicate
yeah.
with someone else. Hey, we want to get this job done. We want to have fun doing it too. So a lot of it is when you have that ability to work at different levels as a manager, I want to say a manager or an employee or a volunteer, allows you to work at all levels. So once you get into profession, realize that's going to be your whole life, maybe in a job or even a home life too. When you learn the communication skills, how to connect with someone, how to work with somebody, allows you to understand how that can help you in the future. So I love that you guys have done that so far. How about you, Miss Carma? What have you done?
I volunteer with cancer kids. We just help them, like, help them with making sure that they're having fun outside of like getting cancer treatments. That's about it. Yeah.
When you first started doing that, was it uncomfortable?
Yes. I
Yeah.
was joining a whole team. It was just through like email, my first encounter, and everyone else was like mutual friends, so it was kind of hard for me. But now I have an amazing team. We're working like together. So.
What's amazing when you go through something, and everyone else can learn from this too. What Karma's saying is that when she first started talking to these kids, it was uncomfortable. Okay, you want to be uncomfortable to get yourself to a comfort level with that same environment. This is life, people. It's not even just volunteering. When you're uncomfortable, at that point, you learn to get comfortable in that situation that helps you with your next uncomfortable situation. The next one, it's a learning experience that you carry on the next environment, next schooling, next people you meet, next people you work with also too. All right, so phenomenal, Karma. Good for you. Good for you. Mr. James, what have you done so far?
I've done some volunteering at like food banks,
Good.
and also there's one I did volunteering at some local orthodontist office, which was pretty fun.
Why was it fun?
Just like it's my first experience in like a work setting, I'd say, and
Mhm.
just like seeing the actual professionals like go do procedures on their patients and like braces and that stuff was pretty interesting.
How do you like the communication with the doctor and patient at that point, or what did the doctor talk about when he was doing the procedures?
Yeah, I felt like these procedures, like getting braces, is like a long-term thing. So a lot of the doctors knew their patients' names and like they asked like personal stuff. So a lot of like everything was personal.
It's almost like their return visit will be like, hi, your name is Johnny. Let's tell you what Johnny's up to. You want to make sure that you're making them comfortable too, correct?
Yeah, I'd say
A lot of
that.
these going to be basically kids, I think, your age, even younger too, getting braces. So they may not be comfortable, they may not have a good day. So you want to make sure they're leaving, no matter what, you want your patients to leave in a happy mood they came in with. That's the key. Sometimes, as you probably knew too, James, is they'll say like corny jokes sometimes, right? And they'll make it almost corny just so they hear a little giggle like that. So they leave them with a sense of I feel better. Maybe my teeth still hurt because I just got the braces on. They're going to get tighter and tighter. It doesn't feel good, but I feel like I'm in a good mood when I leave my office. So that makes someone want to come back there and talk well about that office, help build the reputation up long term because he left in a good mood. Right, James?
Yeah.
Makes sense. But I like that you in office volunteer work too, same thing, because you saw that relationship. Okay, this isn't too scary. I'm seeing it from a different perspective. If you had braces before, I'm being from a doctor level, not a patient level. So it's a lot different. All right. And Miss Ellana, is that right?
Yes, correct.
Ellana, so what have you done, ma'am?
So I have volunteered at Chalk Children's Hospital in Orange County.
Awesome.
I started off as a playroom volunteer in
Cool.
which I interacted with kids and really just kind of give more
Right.
free time to the parents while they work through that stressful situation. And I eventually moved up to a bedside volunteer where I kind of made sure that the patients and their families their basic needs were met. And I've also volunteered at a food bank as well.
And when you worked at the with the kids and moved up to the bedside manner, how long did it take you? How long have you been there?
So I was there for over a year,
Mhm.
And for in order to move up to bedside volunteer, you get to be there for 50 hours.
Mhm. How many people that you started with that didn't want to do the 50 hours left?
It wasn't a big group of us. Usually in my morning shift, it just consisted of like maybe 7 of us.
Mhm.
But we're all on like kind of different schedules. So unfortunately, I wasn't able to see how many people went to bedside and how many stayed since it was such a huge hospital. There are so many roles to fulfill there. So it was very diverse.
Good, good, good. And a lot sometimes you'll see someone that may not be as dedicated to care for people. They'll be tested that way. And that's a good way to go. Do I really want to do this or not? Which is good to do either way. Yes, stay or don't stay. But you want to, like you all have, you've done some feel, okay, this is something that I want to do. Do I care for people? Do I want to help people? Or something like maybe it's not my comfort level. So you have to listen to your personalities. For you to go from playing to bedside manner, was that uncomfortable to that transition, or was that easy for you?
It was really comfortable for me. I've always had a passion for connecting with others and I enjoy interacting with other individuals. So that was like actually my main goal. I really wanted to
Good.
move to bedside volunteer and really just get that experience of interacting with patients and their families.
And
But I loved working with the kids as well in the playroom.
that's going to be funny no matter what. And when you went to bedside, what was uncomfortable? What kind of you want to call it story or situation was uncomfortable that you had to talk about?
I would say the most uncomfortable thing is kind of just the initial interaction of, let's say, for example, I worked early in the mornings on Fridays.
Okay.
I started my shift at 8 a.m. So as a bedside volunteer, we do have to knock on the door and kind of see if the patients need anything. So you kind of just don't know what to expect when you walk into that room. You don't know if the parents and their children are kind of going through an experience or having that moment. So you don't know what you're walking into, and you just kind of have to really be able to adapt to the situation and learn what to say, what not to say. So it was definitely it was a learning experience, most definitely, and just how to interact. And I've learned to not to really ask how someone's day is. As much as you want to ask how someone's day, it's just the common thing to ask. But at the end of the day, it's like people in the hospital aren't dealing with something so minor. Usually, especially at Chalk Children's Hospital with children, it's usually some serious cases I have seen.
Well, you're basically living the life of a healthcare professional every day when you're doing that. You're walking into a room, you may know their diagnosis, their treatment plan maybe, but how are they doing that day? How is that day?
Correct.
Especially if there's parents there. A lot. So having that I won't call it icebreaker, but hey, I'm here to help. What can I do to help? Or how things going? That saying that in a certain way shows compassion and caring. You can also say it in like, how's your day going? And with
Yeah.
no energy, people are like, okay, you just brought that way down. So really giving that experience and time allowed, I think you allowed to understand, okay, I want to do this for a long time. I can break the ice with people and not feel uncomfortable.
Yes.
Fantastic. And realize part of what you're doing too, beyond the internship, is you're almost finding mentors at the same time to help you gain through the process of becoming a better person in healthcare. A lot of what I've done in the past myself is through, again, my previous partner's partner. I learned to mentor as a chiropractic doctor with care, but also to my previous ones too. I've looked at videos. I've read a lot of books for one too on what I want to do in my personal and professional life. So there's mentors everywhere now with the internet, the World Wide Web, as we called it back then, AOL, whatever you want to call it, allows you now to find mentors everywhere. So if you want to become a chiropractor, podiatrist, a healthcare practitioner, or a brain surgeon, you can follow a brain surgeon's story. You can look at on a YouTube video, Instagram, whatever you want to find, and see exactly what you want to do. A lot of it is when you have your free time, which we all do, is what am I doing in my free time? Am I looking at something that's going to help me in the long run, or really not to my overall benefit? And again, you want to have fun as much as you can, but are you finding mentors out there and volunteering so that volunteer turns into a possible job in the future to make your life easier, to build that relationship with doctors around you, nurses around you, coordinators, especially office managers if you work in a private office, even a hospital too, work with them, and even ask them for a reference. So I told all my interns, before you leave, I want you to write up your own reference, and I'm gonna edit it, of course, but I want you to have a reference list. Hey, I worked with you. Can you give me a reference, a character reference? So you have that. So if you never see them again, you have it on paper. It's in print what's going to happen. So as you build your routine, as you apply to these other schools and even jobs too, you have these character references that you volunteered here, you were here. If you lose that contact, at that point they might put on a piece of paper, I worked here, but there's no one to back that up. So having someone to sit there and go, hey, I worked with Ellana, I worked with James, I worked with Justin, I worked with everyone on this Zoom, allows them to go, hey, look, I have someone they can call. They may not call, but you have someone to back up your information. All right. Part of my story became a chiropractor. Finding a job for me was easy. And I was one of the few that actually lined myself up along with my friends too. My second semester in school, between my second and third semester, or I think between my first and second semester, I read a couple of books. What I did, took my alumni list from my school, my chiropractic school in La Habra. And what I did is match up what we had. You guys know what the yellow pages are? The yellow pages? I see a lot of blank. Yeah, I love the blank stares. I love them. Okay, I love them. Okay. What they are, Miss Amber, I see that stare in there, Miss Amber. A lot of it is we had a book, something like this. It's called a book. Okay, it's a book. And it was yellow. Had all these ads and all the professionals in your area, Greater Inland Empire, what we were, I think we were called back then too, as a more, because everything back then was brick and mortar offices. So you had your address in there, you had alphabetical orders. So a lot of businesses would do like, we're the AAA towing company, whatever. So you came in first, you lots of further, it's marketing, right? We had bought a double, called the double truck ad, where you would take, for example, this page in this Mosby's book. And what we did, we had a double truck color ad. So it was like bright and shiny for like $1,500 a month. It was, back then it was a lot of money. Okay. And so we used to do that a lot, but some point back in 2010, 2012, this internet thing popped up, YouTube videos, websites, boom, 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 boom. So a lot of that yellow book went away. The yellow pages went away. So we had to go to social media for one too. So I took that yellow book, back to my story, but that yellow book, Karma, and what I did is I took that pages and I looked at my list, my alumni list, took the yellow pages and matched up those doctors with my school. I called them, about 10 of them, and about 4 of them allowed me to come and volunteer in their office. So what I did when I volunteered, I'd ask them questions. Hey, I'm a chiropractor, been chiropractic about 2.5 years, so I wasn't a threat to them, wasn't a local threat, not the local chiropractor down the street. But I said, hey, look, can I come to volunteer? Out of those 4, I worked with about 2 of them for about probably one for about 6 months and one for the next 2 years. After 2 years came up, he asked me as I was graduating, when can you start working here? I didn't even have to ask. Most of my classmates never volunteered, never worked in an office, never did that background, if you want to call it, building a reputation, building their character per se. At that point, they came out of school looking for a job. When you come out of professional school, graduate school, medical school, chiropractic school, dental school, whatever you want to do, you don't have a job lined up, the clock starts ticking because now you start paying back your student loans. You don't have money coming in to pay for your personal bills. So you have to think a step ahead, Mr. James. What am I going to do if I'm going to go to this school? How am I getting and learn? If I'm going to this school, maybe say become a cardiologist. At that point, it takes many, many years. That's just let you know, heads up. At that point, how do I start working with a cardiologist or someone in heart condition surgery? How do I get my foot in the door to learn what they do in the background? Even if it's 1 day a week. But can you, wherever you want to go, as you guys have already, which is phenomenal work, is going to, if you're testing waters, how do I talk to that professional, what they do, how their schooling was like, how they like about the school, what they did not like about their schooling, what they don't like about the profession. So you learn the good and bad. Back to when I thought about becoming a chiropractor, thought about it back in last century. At that point, I went to a website called quack.com. Okay. It talked about everything negative about professions. Said like this, you don't want to do this. And I said, well, why is chiropractic okay? He said, if they take x-rays, if they look from a scientific level, then I would see a chiropractor. I said, boom, That's why I found my profession, because I like the medical background. I love understanding science. I love work with the human body, physiology, right? Okay, how the bones work, how the bones move, how the joints do, how the muscles heal. I love human physiology, but I want to be a people person and not be stuck in a lab or hospital every day. So that's why I chose this based on my personality. 20 years later, I still love what I do. All right. Any questions so far? Mr. James, any questions? Nothing yet? How about Amber? Anything yet?
Yeah, I was wondering, what was your schooling process like to become a chiropractor?
Good. The first 2 years is basically you're in school 8 hours a day. Okay. Taking anywhere from physiology, biology, biochemistry, philosophy, and also adjusting too. A lot of what I do is work with my hands all day. Okay. I need these working all day long. It's an art form. It's an art profession. So you have to have over time the tactile sensation to feel someone's spine and really their skin and bones and everything else too, to see where things are not moving properly and learn how to quickly thrust and move the bone without causing injury to the spine. So you start out the first semester working with, for example, just a piece of material, say a piece of cloth, then a piece of wood, and you work through that so your fingers get more sensitive. Because of that, then you start working on each other with soft tissue, they call it palpation of how things feel, how things are moving. How does a stuck bone feel? How does a moving bone feel? How does the bones of the neck, because the neck bones versus mid-back and low back bones are all different along with your hip. How does each bone feel differently? How do they move? Kinesiology, how do things move in space for one, too? How the bones move differently in space. So you want to learn all that up front so you can see it in your head. When I adjust someone and check their feet level, when I check their shoulders and where they're rotated, because every joint has a secondary motion one being lateral bending or lateral bending left to right, forward or backwards, also rotation too. You want to know where things are moving and moving out of. I had a guy come in, for example, Amber, last Friday, and he had a bone that wasn't straight. It was twisted to the right. So I had to figure out with about palpation, it was twisted to the right, then pop it back on the left to get that bone in place. He could breathe. It was a rib bone, so he was holding his breath. Once I popped it back in, boom, he could breathe again. So it's understanding that takes time to build, takes time to have that sensation. Also, we do too with schooling, a lot of it is adjusting each other. So a lot of adjusting over time, because we see like 300 people a week now. Over time, as you build up that if you want to call it physicality, is you have to be physically strong for the long run. You have to be able to push on people that are sometimes twice your size. I had a guy coming back in October of 2016. I remember this long time ago. He was 480 pounds and 6'8", a beast. I measured myself this morning for some reason. I'm 187 pounds and almost 6 feet. So I was like a ninja jumping up in the air. I had to jump in the air and just like, I'm going to get this thing moving. I moved. It was like, no one's ever moved my neck. I'm like, yes. So I was able to move bones, but it took, without hurting myself, to be able to do that because I stayed physically active, physically healthy, and learned to do it the right way. So having someone like Amber, you're asking, having someone who you can mentor under, maybe a chiropractor that has done it for a while and teaches you the right technique, allows you to do your field for a long time, especially with dentists, right? Okay, as a dentist, what dentists do all day long is what they'll do. James, right? James, you saw a dentist? You went work in a dental office, is they lean over all day long. They're like this, working all day. Okay, that's gonna hurt your back. It's gonna make your back sore. So you want to make sure you keep your back strong and keep your back loose so you can do your work. Even I see a lot of dentists in my office that have hand tingling, hand numbness because their neck gets so tight. So I want to make sure I teach them and show them, because they don't learn this in school, how to make their neck looser. Yes, we'll adjust their neck, but also make their neck muscles looser, then stronger. We have to stay strong, people. That's the biggest thing. Whatever you're going to do, when you have better strength, allows your body to actually move better and not be in pain so you can do your profession longer. I had a dental hygienist come in here probably about 2 years ago, fresh out of school, started working. She's like, man, I am so tired. I go, how many days you work in a week? 2 days a week. I'm like, 2 days a week? You're exhausted? What? So she had to learn the physicality of her job start moving more and more and more to get things going. Okay. And part of it too is karma, right? Karma.
Yeah.
A lot of it is with karma is when we're moving around, we have to make sure our body is going to be efficient as much as possible. So whatever you want to do profession wise, can we get our body to physically stay strong? And over time, as you get stronger, we build up more endurance naturally for one too. So Amber, going back to your question too, school is about 3.5 years. The last year, so you do a lot of internships. Okay, you're in different clinics around the city per se. I think there's one in Hollywood, one in because I'm in Upland, one in Glendora, one in Corona, one in Pasadena, and somewhere near La Habra also too. But you have to do so many hours of adjusting, of exams, of therapies too, to get your overall license approved from the state. Part of what we do too, there's 1, 2, 3, 4, a part of national board exams. You have to pass all of those also, so that you're legally able to get you become a doctor, a licensed doctor. You pass your ethics exam too. That'll be your full doctorship to say you're a doctor of chiropractic. Gives you 2 letters after your name and probably a big student loan too, like me. All right. Who do you think? Are you guys gonna get student loans for your schooling in the future, or are you gonna pay cash? What do you think?
Cryptocurrency. They're going to pay in
Cryptocurrency. I'm buying some Bitcoin today. It's down today again. Buying some more. Okay. And then with Miss Carma, have you thought about schooling in the future? What do you want to do?
I've thought about like cancer research. That's the plan. But I'm still also trying to figure out like different pathways.
Good. And that's, again, you got to think, if I'm gonna do cancer research, I need my undergraduate, yes, but I probably need my PhD also too, correct? Good. And you're almost gonna look at, okay, if I'm gonna go to school, what schools offer that, and what do they require grade-wise, internship-wise, research-wise, and even SAT scores or whatever it might be to get there, correct? That's all of it. I think when you think about whatever I want to go and back it up to go, okay, what does that require? How do I get there? And then maybe if I can volunteer in a lab or something like that, or meet with someone or talk to somebody, at that point, I want to make sure I'm going there. Because once you go into something like that, that's a very tunnel vision, which is phenomenal profession. If you get there and you go, this isn't for me. And then people go like, okay, you've spent how many years in school, how much money, how much of your time, then you want to back it all up. Okay. I know medical doctors, even chiropractors, like I said before, that have started and gotten their license. When they get their license, they go, I don't really like people. I'm not a people person. Like, then why get in profession? So testing the waters now, like you guys have been, allows everything to actually feel that overall benefit to make that what you want to do. And by, as you have been, internships, mentoring, finding videos online about what you want to do, and talking to those people if possible, and meeting with people, especially volunteers like these people here, allows you to understand, okay, am I really what I want to do, or am I just kind of going in the waters for one also? I'd rather, for my kids, I have 4 kids as far as I know, I'd rather them take a year off of school. I'm glad you got that. I like it to take a year out of school versus going in something and then backing up again. Well, I'm not really into that. If you want to make sure you've done enough of your research and testing the waters and volunteering, so you really know what you want to do. All right. Any questions yet?
I'd like to throw in a comment here, because I think one of the things that might be helpful for our students is to sort of give contrast and comparisons. So one of the things that I may not be so obvious is chiropractic versus, let's say, research. Research is one of those things where it's very unknown, uncertain. You can spend years working towards answering a question, and turns out we still don't know. So there's a lot of uncertainty in research. And so if you're a person who really is comfortable with that and embrace that, then research will work out well for you. But if you're someone who really wants to know more periodically than not that your work is making a difference, chiropractic, your patients will tell you before they leave, thank you, I feel so much better. So instant gratification, right? So those of us that really like that immediate feedback, I think it's a better fit to go that route. So again, all these different options, you need to really think about what Dr. Tony's saying. He's not saying this health profession is better than this. Look at US News ranking. This is number 3 versus number 8. You should do number 3. What he is saying is you got to know yourself well to figure out what profession, what career aligns best with you, pun intended. So I do have 4 questions that I would love to ask the students. The first question, it's a poll. I'm going to launch it right now. This says, how much did you know about the chiropractic profession before this session? So go ahead and answer those 4 simple questions, and then I will share all the results. We have 8 of us here, so Alba, you could participate too if you want. So I see 1 person has completed the 4 questions. 2. Come on, you guys, you don't need Princeton Review to do well on this. It's just a survey.
Is it A, B, and C? Yeah, yeah.
That's actually true and false.
Oh,
it's
gosh.
binary.
Give me a headache, June. All these questions. Can't handle it.
All right, I'm going to show the results. Here we go, and share the results. So we can see we had, 1 person who felt they knew a lot about chiropractic. 3 people said somewhat. 2, very little.
Better than I expected, Jim. Better than expected.
Yeah. Maybe it's 2.5 men, because I believe one of the character was a chiropractor. Unfortunately, they use that as a butt of jokes. But number 2, true or false, chiropractors can write prescription. 4 said it's true. 2 said it's false. I got to tell you, I'm not quite sure myself.
It is false. In our profession as a chiropractor, because we're a healthcare profession, wellness profession, we decided not to do prescription medications or surgery. They have phenomenal doctors that do that. Because we're more of a health profession, more naturally treating people, we want to focus on that natural treatment. So we do not prescribe medications.
Wow, I did not know that. All right. Number 3, agree or disagree. Chiropractic is not based on scientific evidence. I was going to put based on patient anecdotes, but it looks like they all disagree that there is evidence-based.
And a lot of it is there's two parts of chiropractic. One is philosophical, yes, about understanding how the body works. Realize this was invented or created, even though there's been people working with bones, say, for example, in Asia and South America, but chiropractic was started in the US back in the 1800s, where there wasn't a lot of science yet. So chiropractic started as a philosophical career or profession. Then the son of the founder, he actually did the science behind that over time to really make it more scientifically based, more scientific evidence for what we do. So that continues on now with research, not only in chiropractic schools, but also in health schools too. UCLA has a great program right now too. They're doing research on how to make it more medically based, more scientifically based, meaning more reliable, more testable to show more successful results. So yes.
But, I'm going to speak as a patient because I love my chiropractor. You know what? Even if it's just pure placebo, I don't care, because when I go in, I'm in pain. I can't move. But when I leave, I'm feeling a whole lot better. So I don't need, quote, an evidence or x-ray to tell me that this has changed. Because for me, I went in because I was in pain, and I'm leaving without the pain. And you know what? That's good enough for me. So. All right, last one. Ooh, this one is nice because it got a split 3-3.
What?
True or false? Chiropractic services are not covered by health insurance.
They are yes, under certain plans. So it is a 50-50 split. Okay. Some insurances cover, some do not cover. So in our office, we focus on the ones that do cover, and the ones that do not. A lot of people have been going to paying out of pocket for their care. There's even clinics and corporations nationwide that just are cash only practices, because like Joon's saying, it's so successful to get people's quality of life back to what they want to be and how they want to be normal. So it is half cash at this point, half cash, half insurances. And if you're in a car accident, then your car insurance will pay for some of that care too, based on the accident case, based on the trauma.
Thank you.
You're welcome.
All right, students, we are winding down here. Any other questions for Dr. Tony? One of the things I love about having him is he goes beyond just the chiropractic, right? I think all of you guys have learned some really important things about what it means to be a provider, healthcare professional, how to connect with your patients. I mean, those are some really, really great tips and advice. And even to have you guys speak about your own clinical experience and volunteer experiences. That's been great.
But June, one more thing I forgot. I only have 5 names on here.
Yeah.
Who did I miss today? Who did I not talk to?
Let's see. Well, Alba is the one that left. So we got.
Who did I miss? Who's in the right corner with the TV on top of her ceiling there?
Oh, Jasmine.
Jasmine, I missed you, Miss Jasmine. Apologize. Miss Jasmine, I want to hear what kind of volunteer work done so far.
I've just done women's shelter, food bank, and then hospice care.
Okay. How was hospice care?
It's good. I think, as Justin said, it gave me a lot of communication, people skills.
And was it uncomfortable initially, or was it comfortable?
Uncomfortable initially. I think
Good.
It expanded my horizons. So.
And when you say uncomfortable, how did it make you feel?
I think I don't know how to act, because obviously it's hospice. Like, some of these patients are on their deathbed. So I think it's.
Hey, having a great day?
Yeah. Like, maybe I'll see you tomorrow. I don't know.
Right.
Maybe I'll see you tomorrow. Maybe I won't.
Yeah.
But I think it allows you to, like you're saying, allows you to get uncomfortable to get comfortable. So apologize, Jasmine, I missed you earlier. I just want to make sure I caught it on to you too. All right. One thing is, when I talk to you guys too, and I say your names, that's one of the biggest things you can do in healthcare is know someone's name. When you know someone's name, you have an immediate comfort level with them. You have immediate trust with them. When you walk in a room and go, hey, James, I saw you yesterday. How are things going? Hey, Alba, how are things going overall? How's yesterday? What did you do yesterday? You had to go for a walk yesterday. You know, when you know someone's name and know a little bit about them, that personal touch goes a huge, huge long way. So that's why I wanted to make sure you knew all your names. And same thing to Justin. When you get that down, look at someone you talk to them, look at them. If you want to shake their hand or give them a fist pump, at that point, it shows that respect, that human respect, the human kindness that those people don't do anymore. So good. You guys are good people. You guys have many moons to go. I love your dog. Love your dog. But a lot of it is when you have that contact and you guys have a future which is so bright, enjoy your time with your people. Maybe with your students, with your teachers, pick their brains, ask questions. Don't let a moment go where you're not learning something. I'm 48 years old, 1,000 years old, as my kids say. I still watch videos every day. I still learn maybe personal stuff, professional stuff. Watching a video right now on more marketing things from last year to this year and how to improve that. And even I still go back to my old video, my classic videos of Think and Grow Rich and things like that, old books and videos of continuing to learn my process of communication and mastering that as much as I master with my hands, treating people.
Very good. Very good.
All
These
right.
students will get a chance to hear from a vet med student, a veterinary student. So, all right. Thank you, Dr. Tony, for joining us and sharing all your wisdom.
Appreciate it. Thank you for your participation too. Appreciate that.
All right. Thank you. All right, students. So we're going to go ahead and take our lunch break now. And so we'll see each other.